What is infectious mononucleosis? I am Dr. Nadeem Sajjad Raja. Infectious mononucleosis is a disease caused by virus Ebstein Barr virus. Mononucleosis is contagious. It can spread from person to person through secretions. This disease is common among teenagers and young adults, especially college, university going students. So, what causes infectious mononucleosis? Mononucleosis is caused by Epstein Barr virus or EBV. EBV is found all over the world. Most people get an EBV infection at some point in their lives, but only some of them will get the symptoms of infectious mononucleosis. EBV infections often happen during childhood or when someone is a young adult. EBV infections in children usually do not cause symptoms, and when they do, it is hard to tell the difference between the symptoms of infectious mononucleosis and symptoms of other common childhood infections such as the flu, Streptococcus group A, and some other infections. Teens and young adults who get EBV are more likely to have signs and symptoms that are typical of infectious mononucleosis. EBV and other viruses that cause mononucleosis are usually spread through body fluids, especially saliva. This means that you can get it through kissing. That is why infectious mononucleosis is sometimes called the kissing disease. But you can also get these viruses if you share food, drinks, forks, spoons, or lip balm with someone who has mononucleosis. Other less common ways of getting an infection are through blood transfusion, organ transplant, and blood and semen during sexual intercourse. What are the symptoms of infectious mononucleosis? The symptoms of infectious mononucleosis usually start 4 to 6 weeks after you get the infection, but they may start sooner in young children. The symptoms often develop slowly and they may not all happen at same time. So the signs and symptoms include extreme fatigue, so patient feels tired, fever, sore throat, head and body aches, swollen lymph nodes in your neck as well as armpits, rash over the body, liver, spleen are swollen, and sometimes both are swollen, but it is less common symptoms. Most people get better in 2 to 4 weeks. However, some people may feel tired for several more weeks. So patients occasionally experience the symptoms for longer period, maybe for 6 months, and in some cases even beyond 6 months. So how is infectious mononucleosis diagnosed? Your healthcare provider, your doctor, either general practitioner or hospital doctor, may diagnose infectious mononucleosis based on your sign and symptoms and physical examination. The examination will include checking to see if your lymph nodes, tonsils, liver or spleen are swollen and they are palpable. In some cases, your provider might also order an infectious mononucleosis test to confirm the diagnosis. So, what are the common treatments to treat infectious mononucleosis? There is no specific treatment for infectious mononucleosis. Drink plenty of fluids to avoid dehydration. Take rest, tablets for pain and fever. But remember a few things. Do not give aspirin to children or teenage because it may cause Reye's syndrome. This syndrome is rare though, serious illness that can affect the brain and liver. If you have severe symptoms, consult your doctor, which may suggest some additional treatment based on which organs in your body are affected by the infectious mononucleosis. So please always remember to contact your doctor in case of any illness. Do not take antibiotics because antibiotics do not kill viruses. And one more very important, not to take penicillin antibiotic because they can cause rash. So mononucleosis can cause enlarged spleen, which could rupture and cause medical emergency. So try during this time not to do vigorous exercise in order to protect your spleen, because if you do intense exercise, so there are chances of rupture of spleen. So, and also avoid sports during your illness. Infectious mononucleosis, I think about 1 month you need to take precautions. Can infectious mononucleosis be prevented? The simple answer is yes, by taking precautions, but there is no vaccine to protect infectious mononucleosis. So the other ways, as I mentioned, that do not share food, drinks, forks, spoons, or lip balm who is already suffering with infectious mononucleosis. Do not kiss someone if you or other person has infectious mononucleosis. Wash your hands often with soap and water. Thank you very much for watching this video.